Hello, my name is Sophia Soriano. I am a sophomore, and for my public health presentation, I'm doing childhood obesity. Number 1, public health problem, societal issue. 1 in 5 children, 6 to 19 years old, in the United States alone are considered obese. Physicians use BMI, body mass index ranking, and a physical exam to properly diagnose a child. How does this happen? Lifestyle choices, genetics, eating habits, lack of physical activity, and mental health are all factors. Lack of access to healthy organic food sources can also contribute to this. Where does this occur? Canada and United States lead in childhood obesity. Africa and Asia has increased as well. As you can see on the right, the image depicts the US shaded in hues of red. The dark red indicates that the state lies in the higher percentile of obese children. Let's look at California. California lies between 15 to 20% in obesity, whereas South Carolina in the East Coast is in 20.1 or more percentage of obese children. Continuing, future community risks. Communities are at risk of being overrun by fast food chains. Local resources like after-school programs for children will soon diminish due to lack of participation. Causation factors: children 2 years of age to 19 years old that have high blood pressure, high cholesterol, cardiovascular disease, and breathing issues are more likely to develop obesity. Unhealthy diet and lack of exercise can also contribute to unhealthy eating, and ultimately, childhood obesity. As you can see on the right, fast food chains have expanded across the country. Number 2, how to solve this public health issue. Strategy 1, increase restrictions on permitting fast food chains to establish in communities, especially near schools. Limiting the amount of fast food chains pushes families to cook fresh meals. Promote parks and recreational areas that will increase physical activity. Although this may require more funding, adding parks pushes kids to exercise but also creates a closer community. Strategy 2, limits on fast food advertisement towards children. Ads made by fast food chains can harm kids by providing inaccurate ideas of what healthy foods should be. Continuation. Cultural example: Scandinavia and few European countries implemented tax on sugar and junk food. US FDA ordered to have the amount of trans fat labeled on foods. Community support and engagement. Example: Vida Saludable. Vida Saludable was placed as an intervention for childhood obesity in predominantly Hispanic preschool. This intervention collaborated with community members to feel relatable to their culture. In conclusion, the program was successful in participation from the community and was well receptive. 3. Public health in the future. Research justification. One research that I analyzed was about parental role. An article, The Future of Children, written by Anna Lindsay, Katrina Sussner, Joo-hee Kim, and Steve Gorthmaker, studied obesity prevention intervention that demonstrates the role of parents and how they affect their child's health. More school programs. Studies conducted by Dr. Vugeler and Angela Fitzgerald concluded that students who participate in programs that have lower rates of overweight and obesity. Continuing, my opinion. Physical activity and nutrition are two leading components when trying to live a healthy lifestyle. Childhood obesity continues to grow because families are not aware on how to have this balanced relationship between food and exercising. On the right, you can see a My Plate image that you may have seen when you were in school. In my opinion, more prevention needs to be in order to battle childhood obesity. After-school programs that educate both parents and students will begin to alleviate this epidemic. We not only have to encourage students to eat healthy and exercise, but parents as well. When we get parents involved in education and research, this not only provides a more healthy family, but a better community. If you're interested in learning more about childhood obesity, you can refer back to these websites that I used for my presentation. Thank you so much for your time and have a wonderful day.